right. Nerves in my chest, but I knew it felt right. Choosing my path in a sea of sound. Transducers all lined up, the best one I found. With so many choices, which one should I choose? To extract the full potential of your ultrasound system, make sure to equip it with the appropriate transducer type. Probes are a vital component of your system, so make sure to care for it right. They produce waves of sound that bounce back. Transducers or probes are a vital component of your system, so make sure to care for it right. They produce waves of sound that bounce back. This produces images of bodily tissues and organs. There are three main types. These are linear, convex, and phased array. Linear transducers, as the name suggests, have a linear piezoelectric arrangement. The shape of their beam is rectangular, and they have a better than average near-field resolution, with higher resolution but poor penetration. Depending on the clinical application, you are doing the linear transducer's frequency footprints in applications can vary. With a linear intended for 2D, it has a wide footprint you see. There is a broadband frequency of 5 to 20 megahertz, though high frequency is usually 7 to 15. It is useful for examining the breast, thyroid tendons, and blood vessels, along with measuring the thickness of disease in the carotid artery. It's also useful for peripheral nerve blocks and central venous cannulation, as these structures are superficially located. Flipping through options like pages in a book, loves and losses, yeah, I took a good look. Now I'm capable of it all. With the right transducer, I can't fall. Next is the convex or curved transducer. The convex has a piezoelectric crystal arrangement that is curvilinear. The beam has a convex shape that makes the transducer ideal for deeper organ imaging examinations. The convex or curved transducer, intended for 2D imaging, and has a wide footprint too, with a broadband frequency of roughly 2.5 to 7.5 megahertz, is useful for abdominal and transvaginal examinations, along with the diagnosis of certain organs. With a convex or curved transducer made for 3D, the imaging has a wide field of view. This probe has lower resolution, but better penetration for you. There is a broadband frequency of 3.5 to 6.5 megahertz. However, most of these low-frequency probes are 2 to 5. 3D curved probes are typically electromechanical, using my chest, but I knew it felt right. Choosing my path in a sea of sound. Transducers all lined up, the best one I found. For the third transducer often used is called a phased array. Its name comes from the crystals are arranged in a stacked construction. What phased array, its beam is narrow, near triangular. The phased array has a poor near field resolution with a small footprint. It has a broadband frequency of 2 to 6 megahertz. They use this phased array probe mostly in cardiac and transcranial examinations. Choosing your transducer also depends upon the depth and the location of the area to be scanned. There are a few other types you should know. These include the pencil, the endocavity, and transesophageal. Each have a specific purposes for use. The examination of blood flow, the internal cavities in the heart respectively. Then some probes such such as the laparoscopic transducer, are specifically designed for surgical use. When you are choosing your transducer, pick one that is best suited to your intended application and your patient too. Where is useful for abdominal and transvaginal examinations, along with measuring the thickness of disease in the carotid artery.